Good day, everyone. My name is Dwayne Manuel U. Romano, and I'm here to assess the musculoskeletal system. Prior to demonstrate the assessment, we need to provide privacy for the patient for comfort and trust. First things first, before starting the assessment, it's important to do hand hygiene. This not only protect the patient, but also protect the health provider. In properly starting the assessment, it's important to introduce ourselves and asking the client's identity and also asking her health history. Good day, ma'am. My name is Nurse Dwayne and I'm here to assess your musculoskeletal system. Can I ask for your health history, ma'am? Like muscle pain, redness and swelling of joints, or even limitation to movement or inability to perform activities in daily living. After verifying the client health history, we then move on by inspecting the muscle size, comparing the muscle one side of the body, example the arm, thigh, and calf. After inspecting, we then move on to test the muscle strength, which is the sternocleidomastoid, where I turn the head one side against the resistance of my hand. The next test will be asking the client to shrug the shoulder against the resistance of my hand. Ma'am, can I ask you to extend your hand like this and I will forcefully resist on it. The next test will be deltoid, where my client hold up her arm and resist while I try to push it down. Next is the bicep, where I ask my client to fully extend each arm and try to flex it while to attempt to hold their arm for extension. Same goes with the deltoid. I try to forcefully persist the client's arm in order to test her force. Next is the wrist and finger muscles, where I ask the clients to spread their fingers and resist as I attempt to push the finger together. Ma'am, can you extend your finger so that I can resist your finger forcefully? The next test will be the grip strength, where I ask the client to grasp my index and middle fingers while I try to pull the fingers out. The next test is the hip muscle, where I let my client lay down a bed in a supine position with both legs extended. The client rises one leg at a time while I attempt to hold it down. In the same position, I then ask for the client's permission to put my hands between her knees to bring the client's legs together against my resistance. The next test is the hamstring. In the same position, I then try to straighten and extend the legs of my patient. The next test is the quadriceps, where I ask the client to partially extend their knee while I attempt to flex the knee. I then flex the knee both inward and outward motion. For the last assessment is the bone assessment. I then ask the client to stand up for further inspection and palpating. I then inspect the skeleton for a structure. After inspecting, I then move on to palpating the bones to locate any areas of edema or tenderness. For the final assessment, I then assess the joint range of motion. I ask the patient to move selected body parts. And after that, I start documenting the findings in the client record using printed. To wrap everything, that's pretty much it. Thank you for watching.